Hello, I am Dr. Somdatta Lahiri. I am a consultant GI surgeon associated with Fortis Hospital, Rajbihari. And today I would like to share with you some details on a very dreadful, aggressive malignancy, that is gallbladder cancer. So in order for gallbladder cancer to be treated effectively, it is very important that it gets detected early. So what are the symptoms? Now, initially, patients generally have vague symptoms like heartburn, some indigestion or flatulence after meals, and they waste a lot of time buying over-the-counter antacids, maybe say for months to years. By the time these patients present to the consultant, it's generally late. So what are the late clinical features? You may have a constant upper abdominal pain, more on the right side. There may be jaundice, and sometimes you can feel a lump in your right upper abdomen. Of course, in the very late stages, you may also have a tense, distended abdomen due to collection of fluid. That's called ascites. So what do you do when you have the vague symptoms? How do you differentiate them from normally occurring peptic disorder? So you have to get an ultrasound done, but that should be in consultation with a properly qualified and trained physician. So if you have a recent onset of these symptoms after the age of 35 to 40, not long-standing acid disorder, then you need to be concerned. You should go to your consultant and inform him or her that you are having a recent onset of acidity, intolerance to meals or pain, and he or she will suggest you what investigations to be done. So there is a range of investigations like ultrasound, CT scan, MRI, EUS, several others, but what needs to be done in your particular case has to be decided by your doctor. I would just like to add one thing at this point. This is one of the malignancies where it is not necessary to put in a needle and take a biopsy before the treatment initiation. So particularly if it is operable, if you are in an early stage where you can get operated and cured, then it is not necessary, rather it is not advisable to go in for an FNSE or biopsy. And there are a lot of effective treatment for this disease nowadays, like surgery, that's called radical cholecystectomy, in which we take out the gallbladder along with the adjoining liver, the lymphatic tissues, and the bile duct may also need to be taken out if it has been involved. So after that, depending on your histopathology report, chemotherapy or radiotherapy may have to be added on. For all this to be done and to cure this disease, it's very important that you get detected early. So once again, do be aware of any change in your symptoms after the age of 35 to 40, and wish you a happy life. Thank you.